Hello, we're back to part 2 of wind stroke in traditional Chinese medicine and looking at the acute stage of the stroke. Remember, this is for acupuncture students only. Please pause and read this. The most important thing to say is that at the acute stage of a stroke, what we need is quick hospitalization. So remember from the previous video how we diagnose a stroke. We will not offer any treatment at this stage unless it's alongside Western medicine treatment and with the full consent of the patient. What you do need to do is get somebody into hospital as quickly as possible so that they can ascertain whether it's a bleed or a clot and give the appropriate medication. You need to be very careful about moving qi and blood unless you know whether it's a bleed or a clot, which obviously you don't unless you've seen the scans. At the acute stage, we say that the organs are attacked or the channels are attacked. And if the organs are attacked, there's a tense, closed or blocked syndrome, which is essentially pathogens, a full condition of cold or heat presentation. And then there's a flaccid, open or desertion type, which is essentially yang collapse. So if the organs are attacked, the person has been unconscious or gone into a coma. And this might be short term or it might be longer, but that's something that happened during the stroke. If it's tense, then the body goes rigid or closed. There isn't any leaking of the body fluids. So this is our one type. If it's flaccid, then the whole body goes loose during the stroke. And if it's open, then there is leaking of body fluids. So this is our other type, and these both fit into the organs attacked type, where there's a unconsciousness involved. And then there's the channels attacked, and if the channels are attacked, then the person remains conscious. They just have physical symptoms, and essentially this is what we're always going to be treating, because after one of these things, what we see is the sequela is that the channels are still affected if we need to be treating it. As I said, Western medicine takes the work here, but we'll look at these syndromes so that we can understand them. So with tense or closed syndrome, there will be a loss of consciousness. And when that happens, everything becomes clenched and goes into spasm. So the fists, the jaw, the muscles all tighten up. There might be some obvious signs of phlegm. Everything closes, so you might get retention of bowels and retention of the urine. We can see two different types of this. If there's more heat, we get red face, sticky yellow tongue coat and rapid pulse. And if there's more cold, we see a pale face, cold extremities and a sticky white tongue coat. We're getting either cold and heat, wind and phlegm building up here. If you are treating, the main focus is going to be resuscitation and opening the orifices, relaxing spasm, clearing heat, expelling wind and resolving phlegm. With flaccid or open syndrome, again this is organ level, so we get loss of consciousness, but this time everything is open, so we get openness, flaccidity and leaking. So incontinence of the bowels and urine, profuse sweating, cold limbs, the mouth's open, the muscles are relaxed. The pulse will be minute or hidden or scattered, so very deficient pulse, and the tongue will be pale and swollen. So this is essentially collapse of yang. Again, we're unlikely to treat it. If we do anything, it may be to promote resuscitation, and the points that are used to rescue yang are here, obviously using lots of moxa. Channels being attacked can represent three different things. First of all, it can be external wind just invading the channels. So we see this not in a stroke but in Bell's palsy, when just the channels are affected by external wind. We see this in a mild stroke or a TIA where there hasn't been unconsciousness but the other aspects have been affected, so there might be some symptoms in the speech or in the limbs. And we see this after the more serious types of stroke as a sequela. So we see this in the recovery stage. So we need to treat the channels if we're treating the stroke. So milder, no lack of consciousness here if it's just the channels attacked, and if it's just the lomi being attacked, then there's numbness without any loss of function. If the deeper channels are affected as well, then we might get hemiplegia, dysphagia, facial paralysis, slurred speech, our usual symptoms, but without the deeper unconsciousness. How we're going to treat this is expelling the wind with some of these well-known wind points, but most important treating the channels themselves, and we'll talk about that later. Thanks for listening.